So exercise consideration for persons with MS, and as you're probably going to start to see, is the recommendations don't change all that much between healthy adults, patients with stroke, MS, so on and so forth. There's just minor modifications as we look at the different diagnoses at this point. So consequences of multiple sclerosis, you're going to see focal weakness, you're going to see fatigue. A big issue is going to be, when we think about exercise, is going to be heat sensitivity, so intolerance to heat. So we really have to plan our exercise interventions to avoid overheating. Initially, exercise was not recommended for people with multiple sclerosis because it was believed that exercise was going to aggravate their symptoms. And recommendations were originally to avoid exercise because it thought that that was going to preserve energy for activities of daily living and the instrumental activities of daily living. However, this was not true. What actually happened was actually the opposite. The less they exercised, the less energy they had. So we're moving in a direction where MS exercise, it's not a taboo anymore. We're really at the point where we are able to recommend it strongly and confidently. Here are the guidelines we want you to think about. So when we're thinking about exercise, in general, persons with exercise have lower daily activity levels than matched healthy individuals, common across people with neurological disabilities. And then inactivity is going to lead to secondary conditions. Cardiovascular disease is a major problem in people with disabilities. Depression issues, fatigue, osteoporosis, all of these things are going to result from an inactive lifestyle. So what I'm going to talk about is some general recommendations and then specifically resistance and cardiovascular training recommendations. So in general, we're going to target individuals with an EDSS score less than 7. I will explain that in the next slide. In general, our exercises should be individualized and supervised. So very, very similar to what we would do with anybody who's on a exercise program with a disability. We want to be able to supervise it, make sure it's being performed accurately, make sure it's being performed safely, but it's not a canned, everybody does the same exercise, because we really do want to target that individual's functional impairments in order to maximize the benefits. And then again, we're going to recommend resistive training and cardiovascular endurance or aerobic activity. So here's the expanded disability status scale, or the EDSS scale. And I said the recommendations are going to be for people who have a score lower than 7. And basically 7 on this scale is somebody who's restricted to a wheelchair. So anybody who's able to walk even a little bit, these recommendations apply to them. Couple other considerations with exercise. We talked a little bit about exacerbations. The exercise exacerbations of the exacerbation of symptoms, if they occur, they're only temporary. So it's not that somebody gets all this fatigue and all these other increased spasms and all these things as a result of exercise and it never goes away. It's just a temporary situation that resolves shortly. And then we also really have to think about how do we minimize core temperature. So the most common thing that you'll see is exercise in cool rooms, don't exercise outdoors on hot days. Cooling vests are really big in the MS population with exercise. So how do we keep the core temperature down during the exercise activity? Resistive training for persons with multiple sclerosis, you will see a significant increase in muscle strength. So you put something on strengthening training, they're going to increase their strength. They're also going to see improvements in balance, fatigue, and mobility as a result of this new strength. And the recommendations for resistance training, initially, machines are preferred over free weights because there's less room to compensate and perform poorly. So it kind of restricts the movement a little bit. Home-based resistive training with elastic bands or body weight is a reasonable alternative. And then similar to all the ACSM recommendations, we're looking at whole body resistance training with 4 to 8 exercises. Initially, we're going to start with 8 to 15 reps and kind of gradually decrease. And again, these reps are based on a load that shows fatigue at the end of that upward limit. So if I'm saying 8 to 15 reps, that means at rep 15, they either can't perform the exercise anymore successfully, or they begin to have a degradation of the movement pattern. So we're really determining the load or the amount of resistance based on when they get to that max number of reps, they can't really do it any more successfully. Initially, they recommend starting with 1 to 3 reps and progressing up to 3 to 4 reps and having rest periods between 2 and 4 minutes between sets. Similar to ACSM guidelines, 2 to 3 days per week, train large muscle groups before small muscle groups. For individuals with MS, you want to train multi-joint muscles before single joint muscles, and you want to emphasize the lower extremity training. And that recommendation comes because the majority of the impairments or the activity limitations are related to standing and walking. So we really do want to emphasize the lower extremity in people with MS. If we look at cardiovascular fitness training, they're very similar recommendations. For people with MS, we do recommend upper extremity, lower extremity ergometry, aquatics, supported treadmill walking. Things like running, cycling, and rowing are really higher level training paradigms. So we really do want to reserve that for people who have MS, but are really at a higher level of function. And again, we want to perform our cardiovascular activities 2 to 3 times per week. We want to exercise where our heart rate gets up. So this is that moderate level of activity, 60 to 80% max heart rate. And we want to exercise in bouts of 10 to 40 minutes at a time. Again, 10 minutes is really that target level of exercise duration. And then the final recommendation for cardiovascular training in people with MS is you kind of have to start slow. So for the first 2 to 6 months, if somebody's starting to show improvements, you're going to extend the training session. So you're going to take a 10-minute session and bring it up to 15 minutes. Or you're going to take a 20-minute session and bring it up to 30 minutes. The next thing you can do is add an extra day of training. So instead of 2 days a week, you're going to go to 3 days a week. Instead of 3 days a week, you may do 4 days a week. And then after this slow progression over a few periods, over a few months, if it's shown that the patient can tolerate the activity and tolerate the progression of activity, it's only at that time do you increase the training intensity. So a little different than what you would recommend in somebody with a stroke or somebody who's non-disabled, an older adult. You wouldn't make this kind of a recommendation. You may start slow just because you want to see, but this is a very specific recommendation based on the issue related to the fatigue and heat intolerance. Strength is still good.